Good morning, friends. Now, in this session, we are going to discuss about the national policy on safety, health, and environment at workplace, which is drafted by Government of India, Ministry of Labor and Employment. Now, we know that in every country, there should be some policy that is a uniform and a national policy, especially when we are talking about the SHE, that is safety, health, and environment. So what exactly the points should be included by the employer, by the government, by the state government, what exactly the role of community, the social workers, NGOs, and the public for maintaining this safety, health, and environment. So especially when we are talking about this policy, we are focusing mainly on the industries. So it is applicable to all, but we are mainly focusing on the industries. So we will discuss what exactly the policy is, what is the goals and objectives of this policy, how to implement these goals and objectives or the ideal concepts into the fact, and what are the problems or the loopholes in this policy, and then how to improve, how to correct, how to modify or rectify these points to achieve these goals and objectives. So let us discuss one by one. So Constitution of India provides the detailed provisions of these rights of the citizens and also lays down the directive principles of the state policy. So for the understanding the goals and objectives or the action program of this policy, central government and the Constitution of India provides some directive principles of the state policy to understand what exactly the aim to which the activities of the state are to be guided. So on these principles, state government and other committees or other apex bodies in the state government should be act accordingly. So what are these directive principles? For securing the health and strength of the employees, men and women. So this is the first and very important point, that we have to secure the health and strength of these employees, men and women. So when we are talking about this health, nowadays we are knowing the importance, we are understanding the importance of this health and hygiene due to the COVID-19 pandemic, and it should be a safety and health environment culture, then and then only these types of diseases, these types of viruses can be avoided. At least we can avoid the spreading of these types of viruses with the help of this control. So we have to focus on to secure the health and strength of these employees, men and women. Then that the tender age of the children are not abused. So the adolescent age or the age less than 18 years should not abused. Then that citizens are not forced by the economic necessity to enter the avocations unsuited to their age or strength. Normally it happens many times that depending on our target, depending on the industry's target, depending on the company's target, we have to force some of the peoples to complete the task, to conduct the particular task, irrespective of their age, irrespective of their strength, irrespective of their interest. So we have to must try to avoid these avocations. That is, if the person is not going to conduct that activity, if the person is not having that capability, that may be a physical capability, that may be a mental capability, or if the age is very less, or if the age is more than 40. So some of the tasks in the industries, especially when we are talking about the heavy work or when we are talking about the work which may create a mental pressure, that should be given to the young and dynamic persons, and that is why here it is mentioned that we have to control, or we have to not force these by the economic necessity. Just and human conditions of work and maternity reliefs are provided. So already there are some benefits, some rules and regulations which is clearly mentioned in some of the laws like ESI, Work Compensation Act, etc., regarding the maternity reliefs, etc. But we have to maintain these human conditions. That is also one of the important point. So it can be maintained only when your management as well as your middle management is going to focus on these conditions. If they are very well aware about these goals and objectives of this national policy, and if they are really serious about these goals and objectives of this national policy, then and then they can easily maintain these human conditions in that industries or in other workplaces. Then that the government shall take steps by suitable legislation or in any other way to secure the participation of employee in the management of these undertakings, establishments or other organizations engaged in any industry. So the directive principle clearly provides the directions that the government should take some steps, and they should come up with the legislation or some statutory provisions, because uh, in most of the industries, in most of the places in India, unless and until there should be some rules and regulations, there should be some statutory regulations, then and then only the peoples are going to follow all these activities. So to maintain all these safety, health and working environment, we have to secure the participation of these employees to manage all these activities. So these are the directive principles which is provided by the Constitution of India and government. Now, on the basis of these directive principles, the state government and some other agencies, the agencies may be government, semi-government, private, or some NGOs like agencies, or some voluntary workers also. So they have to ensure safe, healthy working conditions for every working man and woman in the nations. To ensure this, not only government but other semi-government and other sectors are also should take the initiatives to ensure these safe and healthy working conditions in the premises or in the industries. So government recognizes that safety and health workers has a positive impact on productivity and economic and social development. So if the government, if the industrial persons, if the other persons or the volunteers who are going to ensure these safe and healthy working condition, obviously it is going to impact on the production. So production may be more, production may be increased day by day if you are going to maintain these safe and healthy conditions in the industries as well as in the other sectors. So indirectly it is going to impact positively on the economic and social development of the nation. Prevention is an integral part of economic activities. So we have to prevent some of the negative impacts, negative activities in the nation, because the important should be given to the prevention is better than the cure. Then and then only our business can perform in a well manner in the existing industries as well as for the newcomers or for the new companies. So for this prevention we have to act accordingly. The formulation of this policy, priorities and strategies in SHE at workplaces is undertaken by the national authorities in consultation with the social partners. So the main responsibilities is given to the national authorities, but only government organizations or the government people can't do or can't maintain all these safe and healthy working conditions in the country. So for that purpose, they have to consult with the social partners for fulfilling such objectives. So the objectives or the goals which is decided by this national policy that can be fulfilled only when the social partners are working together with the national authorities. So with the help of that only, we can ensure the prevention, we can ensure the safe and healthy working conditions in the organizations. The government of India firmly believes that without safe, clean environment as well as the healthy working conditions, social justice and economic growth can't be achieved. Because this is nowadays the peoples are knowing about the industrial hygiene. They are knowing about how the hygienic atmosphere, hygienic environment, the healthy environment and the safe environment is going to impact on the production, on the social factors and on the economic factors. And that is why government clearly says that unless and until these safe and healthy or working conditions or environment conditions are not going to maintain, then we can't achieve these economic targets. So for that purpose, we have to maintain these safety, health and working conditions in the organizations. And safe and healthy working environment is recognized as a fundamental human right. Right? So education, training, consultation and exchange of information and good practices are essential for prevention and promotion of such measures. So there are some companies, especially when we are talking about the large scale companies and multinational companies, they are obviously going to follow all these national policy goals and objectives. They are some of the companies where they are far forward from these goals and objectives also. They are going to maintain the international standards, or they are going to achieve the goals and objectives of the international policy, which is at the international levels. So for that purpose, they are going to focus on the education, they are going to focus on the trainings, consultation and exchange of the information. So if one company is having good practices or good safety, health and environment culture in their industry, they are going to share their ideas, they are going to share their practices, they are going to share how they have achieved this safety, health and environment culture in their industries. If some companies are required some help from the developed industries or from the industries where the SHE culture is good, then they can ask for this help. And obviously these industries who are already developing this safety culture, they are going to provide this information, they are going to provide some guidance, they are going to conduct some sessions or the training, or they can educate the peoples in the particular industry where they require this type of help. So by helping each other, we can easily and in a faster way, we can achieve these goals and objectives of this national policy. The changing job patterns and working relationship, the rise in self-employment, greater subcontracting, outsourcing of this work, homework, and the increased number of employees working away from their establishments pose problems to management of occupational safety, health, risk at work. Nowadays, we are knowing that the contract or subcontract culture is there in industries. The regular employees are not going to take the responsibilities of each and every work which may be hazardous or not hazardous, which may be having some health risk in that work. So normally nowadays the working conditions are in such a way that the companies or the higher level managements are going to give or transfer these responsibilities to third parties or to the contractors. And then contractors may give the responsibilities or may transfer this responsibility to the subcontractors. And this is a culture in the industries or in the organization nowadays. So due to this, the main culture of SHE or main education and training or the seriousness about this safe, healthy and working environment is not 100% transferred to this contractor or subcontractor level, and that may pose a problem. So that is the real situation in the industry. So new safety hazards, health risk will be appearing along with the transfer and adoption of these new technologies also. So nowadays we are knowing about these robotics, artificial intelligence, mechatronics, etc. So these new technologies are going to placed in or going to replace these conventional technologies, right? So with these new technologies, some hazards may be reduced and some hazards may be added. So whatever the hazards due to the conventional technologies that we know, that we have studied, and according to that hazards with the conventional technologies, we have to take care about these hazards. But when the new technologies is replaced, then due to these new technologies, we have to study again, we have to research about these hazards, we have to list out some of the preventive activities, preventive work should be adopted by these employees in that organizations. So we should also take care about these new technologies along with their hazards, along with their risk at different levels. Particular attention needs to be paid to the hazardous operations and of employees in risk prone conditions. So obviously the organizations are knowing about these types of hazardous operations, and there are some rules and regulations also how to conduct these activities which are related to these hazardous operations. So if the standard operating procedures or the safe operating procedures are going to follow by these industries, by the employees, then there will be less risk. But we have to take care about these risk, we have to take care about while operating these hazardous operations, or if the employees are going to involved in these hazardous operations. Especially we have to take care about these migrant employees and various vulnerable groups of employees arising out of greater mobility in the workforce with more people working for a number of employers, either consecutively or simultaneously. So as I have discussed in the previous slide, that nowadays the contractor or subcontractor culture is there, and that is why some of the employees are working simultaneously for more than one industries. So one worker is working for 4 hours in a particular industry, then another 4 hours in other industry, maybe 8 hours for a single industry for 8 days, and again the 8 days for another industry. So the safety, health and working conditions, the hazards, the type of hazards, the risk or the level of risk are different in different types of industries. And to prevent from these hazards, to reduce this type of risk, the worker should go through the trainings, to the educations regarding these hazards and risk. So that is not happening in a serious manner, and that is why there may be some injury, accident or incidents. The increasing use of chemicals, exposure to physical and chemical hazards, biological agent hazards, potentially unknown to the people. So many workers are handling some of the chemicals casually as a solvent, as a cleaning agent, as a chemical which is used by the number of workers on a regular basis. So that is why they are also, or the new employees are also observing that these peoples are handling these types of chemicals from many years, from many days, or from many months. Now we can also easily handle these types of chemicals, but we should aware about these chemicals, their physical chemical characteristics, their hazards like fire hazards, explosion hazards, that may be the characteristics like flammability, that may be a explosivity, that may be some chemical reactions, that may be some fast reaction with air, fast reaction with oxygen, fast reaction with water, or how it impact on your skin or some other body parts. So each and everything should be known to that person. Indirectly, every person should know the MSDS, that is material safety data sheet of that particular chemicals. Nowadays, we are also handling some of the biochemicals or biological agents, and that is why we also should take care about these biological agents and their adverse impact on our health or the environment. The indiscriminate use of agrochemicals, including pesticides, agricultural machineries, and equipments. So nowadays, if you observe the statistical data in India as well as in other countries, we are increasing the use of these pesticides more and more. So thereby, due to this utilization or uses of this pesticide, there are more cases of cancers. So if you observe especially the Punjab, then you can understand that how much cases are there or how many cases are there of cancers due to these pesticide utilizations. We are also to take care about these agricultural machineries, because in many cases only one person or two persons are going to handle these types of giant machineries, and which are risky machineries. So there are various cases where due to this machinery handling, there are fatality cases. So we have to take care about these machineries also. So industries with major accident risk, effect of computer control technologies and alarming influences this stress at work in many modern jobs pose serious safety, health and environment risk. So nowadays we are using these computer control technologies and some alarm systems which may influence of stress. So there are some sounds, there are some LED fluctuations, there are some different outputs from the computer control technologies. So that may create a stress on the persons, that may be a stress in that particular working environment, and due to these modern technologies. So we have to also take care about these computer control technologies or automation. The fundamental purpose of the national policy is on SHE, that is safety, health and environment at workplaces. So is not only to eliminate the incidence of work-related injuries, diseases, fatalities, disaster and loss of national assets, and ensuring achievements of high level of occupational safety, health and environment performance through proactive approaches, but also to enhance the well-being of the employee and society at large. So this is one of the important point in this first point, that is in the preamble, that what exactly the purpose of this national policies. So the purpose is already mentioned in various acts and rules and regulation in India, but simultaneously some points are added in this purpose. So we know that each and every organization or industries are setting their target as zero accident or zero risk or zero hazards, etc. So that is one of the target or purpose of these national policies, to eliminate the incidence of work-related injuries, diseases, fatalities, disaster, loss of national assets, ensuring achievements of OSH, etc. So this is one of the major purpose which is related directly to the safety, health and environment at workplace, and it is a proactive approach. Now simultaneously, well-being of the employee and society at large is another point which is added in the purpose of this national policy. It means organization should not think only about their organization, but they should also think about the society at large. And that is why CSR activities are also included in the organization's activities, and there are specific funding, approximately 2% in the CSR activities are included. That is one of the reasons why actually direct organizations is linked to the society, and that is the organization's responsibilities to solve some of the problems of society which is directly related to the safety, health and environment. So some of the activities should be done by the organizations to maintain this SHE environment in the organizations as well as in the society. So every ministry or department may work out their detailed policy relevant to their working environment as per the guidelines on the national policy. So it is not a responsibility of only one ministry or one department, but it is the responsibility of each and every ministry or every department of the central government as well as of the state government. And that is why, to fulfill these objectives or goals of this objective, each or every ministry or department should study this detailed policy, and to achieve these goals and objectives they have to act or plan accordingly at their local or state level or the national level. Now we have discussed the preamble in detail regarding this policy, that is the national policy. Now we are going to discuss about the goals and objectives, that is second and third point. So government firmly believes that the building and maintaining national preventive safety, health and culture is the need of hour. So the main goal is to maintain these safety and health culture. If you are observing the safety and health culture in the small scale industry, so the culture is not maintained, culture is not there in some of the small scale companies. There are some limitations, they are having some lacunas, they are not very serious about the safety and health culture. But if you are observing in the large scale industries, in some of the middle scale industries, in the multinational industries, then you can observe this maintenance of this safety and health culture, and that is the need of the hour. So to achieve this safety and health culture in the organization as well as in the society, we have to follow some of the activities. So the requirements are, statutory framework is one of the main requirements. So we have already discussed, the Indian peoples are having the habits that if there is some rules, if there is some regulations, if there is some restrictions by the law or the rule, then and then only they are going to follow these guidelines which is given by the central government or the state government, right? So the need of hour to maintain or to achieve the goal is to go for the statutory framework on the occupational safety and health in respect of all the sectors of industrial activities, including the construction sector, designing suitable control systems of compliance, enforcement and incentives for better compliance. So this statutory framework is mainly focusing on some of the areas like construction sector, because in the previous days, if you observe in this construction sector, it is unorganized sector and where there are very less rules and regulation. But if you observe the 96 and 98 laws or the acts which are directly related to this building and other construction workers, rules and regulations, then you can easily observe that from 96 or from 98, the scenario of this construction sector is different one. And now the government is going to adopt some stringent norms regarding these construction sectors. So to maintain all these SHE environment, we have to comply some of the things, we have to enforce, and we have to take some initiatives for maintaining this safety, health and work environment. And for this purpose also, some of the rules and regulations are modified, some of the rules and regulations are added in the central as well as at the state level, and some of the points are included in the curriculum or syllabus of some of the courses like diploma or advanced diploma or degree level. Then the second point which should be adopted to achieve this goal is to provide the administrative and technical support services. So for maintaining this safety, health environment, after adopting the statutory framework, after creating or drafting the statutory framework, we have to provide some administrative and technical support to these services. So to maintain all these things, we have the requirement of these technical support systems, the administrative systems, because these these services are needed to guide, to provide a specific direction to the people, to the organizations, to the society who are not knowing about these goals and objectives of this national policy. Then providing a system of incentives to employers and employees to achieve higher health and safety standards. So to achieve the health hygiene or the hygienic environment, the safety standards, we have to provide some incentives, or there are some systems which are going to provide some incentives to the employers and employees. Then and then only they will get a financial motivation, and then they are going to follow, they are going to achieve some higher standards in the SHE field. Providing for a system for non-financial incentives for improvement in the safe and healthy work. So there are some incentives that should be provided, like some motivation which is non-financial motivation. There are some awards, there are some rewards, there are some competitions, there are some activities, that is social activities or social and organizational activities or industry social activities, etc. So which can gives you the motivation, which can gives you the booster for maintaining, for achieving these standards which is related to the safety, health and environment. Then establish and developing the research and development capability in emerging areas of risk and providing for effective control measures. Now some of the organizations are really trying for achieving these SHE environment, but they are failing in some of the activities. So they are asking how to control some of the bad activities, how to achieve some of these SHE goals and objectives, and for that purpose R&D is required. So some organizations can provide these R&D which are capable in their area, and that can be a emerging area for doing this type of work, that is R&D in the safety, health and environment. So to control all these SHE activities, to maintain all these SHE standards at higher level, we have to go for the R&D in the SHE. Focusing on prevention strategies and monitoring performance through improved data collection systems on work related injuries and diseases. So we have to collect the data which is directly related to the injuries. That may be a minor injury, that may be a major injury, that may be accidents, that may be a fatal, non-fatal, reportable, non-reportable, etc. So diseases may be a notifiable diseases, that may be some other diseases, etc. So we have to collect all these data for taking the preventive actions, for planning the prevention strategies and for planning the monitoring activities also. So if the number of diseases are more, or if the seriousness of these diseases is more in some of the industries or in a particular sector, suppose if some diseases are observed in a specific chemical sector, or some diseases are observed, or some injuries especially observed in some of the engineering sectors or engineering industries, then we have to take care to reduce these injuries. We have to take care to reduce these number of diseases or the seriousness of this disease by preventing some of these activities, and that is why we have to focus on the strategies for the prevention, and we have to plan some monitoring measures, monitoring performance for reducing the risk. Developing and providing the required technical manpower and knowledge in the areas of SHE, because if you observe in many of the industries in India also, that the persons who are taking care about the production activity, who are taking care about the maintenance activity, who are taking care about some ETP or STP plant, they are also directly included in the safety department or SHE department, and they are partially taking care about these SHE activities. But that should not be case, because unless and until the knowledge, the seriousness, the passion about these safety, health and environment issues or the activities is there in that person, then that person is not going to focus only on these SH activities, because mainly they are focusing on their main areas like production, purchase, sales, profit, maintenance, etc. But we have to appoint the persons who are having a technical knowledge, who are having a statutory knowledge, who are having the knowledge about the rules and regulations, who are having the capabilities to do some of the R&D activities in the SHE environment or in the SHE field. That person only should take care about these SHE activities in that workplaces in different sectors. So promoting inclusions of SHE improvement at workplaces as an important component in other relevant national policy documents. So nowadays, if you observe the rules and regulations which are coming, or the amendments in some of the rules and regulations, especially when we are observing the 2016 onwards rules and regulation and amendments, then you can easily find out that indirectly it is a promotion of these policies related to the SH, right? Including safety and occupational health as an integral part of every operations. So each and every activity or the operation in the industry or organization should include these SHE activities or the goals. Now the third point of this policy is objectives. So with the help of these directive principles, with the help of these goals, they have decided some of the national objectives, which is focusing on the safety, health and environment at workplace. So the objectives are to achieve the continuous reduction in the incidence of work-related injuries, fatalities, diseases, disasters and loss of national assets. So it is one of the objectives. Then second one is improved coverage of work related injuries, fatalities and diseases, and provide for a more comprehensive data base for facilitating better performance and monitoring. So we have to do some of the monitoring activities. We have to go for some better performance, which is directly related to the SHE and related to the injuries, fatalities, diseases, etc. The continuous enhancement of the community awareness regarding this SHE at workplace related areas, because the common peoples or the peoples in the society are not knowing about the upgradation or updation about these SHE activities, SHE rules and regulations or SHE policy, etc. So for that purpose, we have to do some activities which are directly related to the society for creating the awareness about the safety, about the health, about the environment at workplaces. That nowadays in our industry we have maintained this type of industrial hygiene, we are maintain this type of healthy atmosphere, we are going to maintain the quality of the water, quality of air, the ventilations, the light systems, etc. We are going to provide these type of personal protective equipment for these operations, etc. So we are going to create this awareness among the society regarding this safety, health and environment issues, continuously increasing community expectations of workplace health and safety standards, because the society, community are expecting more and more about these health and safety standards, because nowadays due to the media, due to the other things like mobiles, TV, etc., the people are knowing about the latest rules and regulations, latest amendments, latest policy changes related to the safety, health and environment. So they are going to expect the higher standards uh, which are related to the SHE. Improving safety, health and environment at workplace by creation of green jobs, contributing to the sustainable enterprise development. So nowadays the people are knowing about the environment issues, they are talking about the air pollution, talking about the water pollution, talking about the soil pollution, noise pollution, etc. And they are also talking about the renewable energy sources, the fossil fuels and their adverse effect, what exactly the carbon emission is, etc. So all these things are included in the curriculum or syllabus at primary education level, and that is why the students who are studying in the schools and students who are studying in the colleges are also knowing about these green jobs, and that is why the expectations of this community is more related to the green jobs. Why they are asking about why our government is not going to focus on the green jobs rather than the jobs which are adversely affect on the environment. Now, up till now, we have discussed about what exactly the preamble of this national policy is, what are the goals and objectives of this national policy. Now, how to achieve these goals and objectives of the national policy? So that included in the action program. So the action program should be time bounded, then and then only. That should be having the importance, how to act in a less time. So the first point is enforcement. By providing an effective enforcement machinery as well as suitable provisions for compensation and rehabilitation of the affected persons. So we have to provide some technical manpower, we have to provide some machineries, we have to provide some instruments to achieve this SHE goals and objectives. By effectively enforcing all applicable laws and regulations concerning the SHE at workplaces in all economical activities through an adequate and effective labor inspection systems. So some of the laws and regulations are already implemented in India. They are also added. Some are modified or rectified as far as this SHE goals and objectives are concerned. Then by establishing suitable schemes for subsidies and provision of loans to enable effective implementation of the policy. So some startup policies are also there. Some of the policies, especially when we are talking about the non-conventional or the renewable energy sources, if your industry, if your manufacturing process, if your activity is based on the renewable energy sources, then government is going to give some subsidy, and that is why the persons or the organization is going to get the motivation due to this subsidy, as it reduces the financial burden. So some of the scheme should be implemented by the central or state government for motivating these SHG policies by ensuring the employees and others have separate but complementary responsibilities and rights with respect to achieving safety, health and working conditions. So there are some responsibilities that should be ensured by the employers as well as by the employees. By amending the expeditiously existing laws relating to the safety, health and work environment and bring them in line with the relevant international instruments. So obviously we have discussed that some of the industries voluntarily taken the initiatives to achieve the international goals related to the SHE. They are also following some of the issues which are discussed in the ILO meets, etc. But most of the industries should try to achieve these goals, which is decided by the international committee members. By monitoring the adoption of these national standards through regulatory authorities, so already there are various monitoring committees which is related to the safety, health and environment. So there are some safety inspector, assistant director, deputy director or director from the Department of Industrial Safety and Health. Then some of the field experts or field officers from the State Pollution Control Board and Central Pollution Control Board, and some of the doctors, visiting doctors or the representative from the certifying surgeon, etc., which are going to monitor all these activities which are going to run by these uh, organizations or the companies, and some guidelines or suggestions are also given by these experts people to maintain the SHE at a higher level. By facilitating the sharing of best practices. So we have already discussed that if some of the industries is best in the health and hygiene area, then that practices or the some of the activities should be shared to other industries in some of the special programs or the MARG activities, that is mutual aid response group. So in the MARG activities, in the MARG meetings also, you can discuss these best practices. So some companies may have some best practices regarding the environment. Some companies may have the practices which are the best practices related to the safety, and very few companies may have their best practices related to the safety, health as well as environment. So all these best practices should be shared to other companies so that they can at least have an idea, they can plan accordingly how to implement these best practices in their respective industries. By developing new and innovative enforcement methods, including financial incentives that encourage and ensure improved workplace performance. So you can decide that some activities can be run and can be planned by the employees itself. So we can give some motivation, we can give some innovative enforcement to that employees, to that organizations, and we have to also provide some of the facilities, some of the technical manpower, some of the technical instruments to achieve all these SHG standards. By making an enabling legislation on SHG at workplaces, so some of the legislations are already made and some of the legislations may come in future. By setting up safety health committees wherever deemed appropriate. So in some of the industries, there are separate committees for safety, for health and for environment. In some of the companies, there are committees formed for SHE in a single department. So whatever may be the case, but the objective or the goal of that particular committee should be to maintain the safety, health and environment standards at a high level with respect to this national policy. Now, what are the national standards? So we have to maintain, we have to create, we have to modify and rectify some of the standard to achieve these policies. Some codes of practices and manuals should be made on these SHE policies. What are their goals and objectives? How to achieve these SHE policies? Then what are the standard procedures that should be followed to achieve these goals and objectives? There should be some uniformity at national levels in all economic activities consistent with the international standards and implementation by the stakeholders in true spirits. So there should be some uniformity at national levels to provide these economic incentives, non-economic incentives, or the motivations to all the organizations, to the society, to the NGOs, to the social partners, etc., so that they can don't have some misconception about these national policies and their motivations. By ensuring stakeholders awareness of and accessibility to applicable policy, documents, codes, regulations, and standards. So awareness is one of the main thing, because in the organizations, the persons who are touching the legislations or the statutory requirements, or who are in contact with the DISH department, SPCB or CPCB, etc. They are knowing about these policies and their modifications, etc. But other peoples as well as the common people in the society are not knowing about these updates, not knowing about these motivations or the schemes which are declared by the national or central or state government. So awareness is one of the important point. Then compliance. By encouraging the appropriate government to assume the fullest responsibility for the administration and enforcement of occupational safety and development at workplace, provide their needs and responsibilities. So the organization should identify what exactly their need and what is the responsibility of the organization, of the specific department, of the specific employee in that area of SHE. So to maintain all these SHE standards, what will be the need, how to satisfy these needs, what are the responsibilities, how to decentralize these responsibilities, how to give the authorities and responsibilities to the concerned people. Each and everything should be decided by the organizations. And to conduct experimental and demonstration projects in connection with this SHA also. So we have already talked about the R&D is the lacuna in this SHA field, and that is why this conduct of some experimentation and some demonstration project is the need of an hour in the organizations. By calling upon the cooperation of the social partners, so we have also already talked about this, that government is not the only organizations which is going to achieve all these goals and objective of this national policy, but for achieving these goals and objectivity, the government as well as the social partners are required to achieve these things, and that is why this cooperation from the social partner is also important. By continuous improvement of these OSH activities and the management policies to manage these systems, strengthening these voluntary actions, including the mechanisms for self-regulatory concepts, and establishing the auditing mechanism which can test and authenticate the occupational safety health management systems. So maintain these occupational safety health and management systems, we have to observe some of the activities, we have to plan some of the mechanisms, we have to monitor some of these activities, and for that things we have to improve in that area on a continuous basis. It is not the case that for this year we have to plan and act accordingly, and for the next year the same policy. It is not possible to continue with the same goals, with the same objectives, with the same instruments, with the same technical manpower. but we have to rectify, we have to modify, we have to strengthening some of the actions, and we have to reduce the risk, we have to reduce the hazards, we have to reduce the injuries, we have to maintain the high standards of the health, hygiene and environment. And for that purpose, we have to change the mechanism, we have to improve in some of the activities and action plan. By providing specific measures to prevent catastrophes and to coordinate and specify the actions to be taken at different levels, particularly in the industrial zones and high potential risks. So we have to identify what exactly the risk level is. If the risk level is high, if there is a high potential risk, suppose for example, if you are handling, storing and manufacturing the nitrogen derivatives in some of the chemical industries, then there is a high potential risk, because nitrogen derivatives are the explosive chemicals. And likewise, you can identify on your own what exactly the risk is, what are the hazards and what is the high potential risk, and accordingly we have to take the preventive measures to prevent the catastrophes. By recognizing the best safety, health and practices and providing the facilitation for their adoption. So we have to recognize some of the best practices which is related to the safety, health and environment. So if it is not the case in your company, then you can identify these best SHG practices in your system companies or some of the other companies in your MIDC or in other areas also. And then you can take the guidance how to implement, how to execute these best practices in your industry by providing adequate penal provisions as deterrent for violation of laws for the time being in force. So there should be some penal provisions to take the penal action on some of the responsible person of your organizations if you are not going to follow these SHE goals and objectives. By encouraging all concerned to adopt and commit to responsible care and or corporate social responsibility, that is nothing but CSR. So nowadays, if you observe in syllabus, if you observe in some of the rules and regulations, they have added this responsible care as well as these CSR activities in their agenda to improve this SHE at workplace performance. By ensuring a suitable accreditation machinery to recognize these institutional, professionals and service relating to the SHE. Nowadays, if you observe, some of the persons, some of the students are interested in this area, that is safety, health and environment. And if these persons, these students are interested in that area, then you can give the responsibility regarding the research and development activities, some of the research projects, some of the trial projects, etc. And to maintain, to achieve the quality in this SHA activity, we have to provide some instruments, some technical manpower, some financial motivations, and some non-financial motivation to comply these rules and regulations. By encouraging the employers to ensure OSH management systems, establish them in efficient manner to improve workplace safety and health. So we have to encourage, we have to motivate the employers also that they are going to have the benefits in the future if you are going to maintain this occupational safety and health and management system in the industry or the organizations. So the financial as well as non-financial motivation, the schemes should be given to the employers, and the awareness about these schemes should be done for the employers who are not maintaining this SHE. By specifically focusing on such occupational diseases like pneumoconiosis, silicosis, etc., because these diseases are directly related to the lungs and respiratory tract systems. So If the diseases are directly attacked on your respiratory systems, on the lungs, then there are chances of fatalities in the near future, or sudden death may be a issue. So for these occupational diseases, we have to focus, we have to control, we have to replace some of the processes, we have to replace some of the conventional processes of your manufacturing processes or in your industry. We have to replace some of the chemicals, we have to replace some of the substances like sand or sand blasting operations, then unleaded petrol instead of leaded petrol. Then we have to go for renewable energy sources like solar, wind power, etc. instead of coal based, oil based, or some other fossil fuel based combustion processes. Then by promoting the safety and clean technology and progressively replacing these material hazardous to human health and environment. So we have already talk about these clean technologies, that is renewable energy sources technology. So if you adopt the solar based pumping systems, then solar based fan systems, then solar based um, lighting systems, or the solar based power generation systems, and likewise if you are following this green technology, obviously you are going to reduce the burden of these fossil fuels. And if you are consuming less fossil fuels, obviously the carbon emissions are going to reduce. So it is going to impact in a positive way on the environment. So this is some of the examples. There are various examples for clean technology or the clean development mechanisms. Then awareness. So we have already talked about this. We have to increase the awareness of these SHG policies, their incentive scheme, their non-financial or financial schemes to the common person and to the employers by providing the forums for consultation with the employers, representatives, employee representative, and community. So each and every person of the community of the organizations should know about these SHE policies, SHE goals and objectives of the national policy. By encouraging the joint labor management efforts to preserve, protect and promote national assets and to eliminate injuries and diseases arising out of the employment. So there are some national assets which is declared by the central government. So to protect these national assets, we have to work on a joint manner. So some organizations, some government organizations, some private organizations, some NGOs, some voluntary persons may join the efforts for the protection of these national assets, and there are some policies, there are some schemes which are going to encourage these peoples or to promote these people for the protection of these national assets. By raising community awareness through structured audience specific approach, then by continuously evaluating the impact of such awareness and national initiatives, by maximizing the gains from the substantial investment in awareness campaigns, by sharing the experience and learning, by suitably incorporating teaching inputs on SHE at workplace in schools, technical, medical, professional, vocational courses and distance education programs. If you observe the syllabus, curriculum, or the conditions in the organizations, in the industries, or in the companies, a previous decade, and now if you are going to observe the change in the curriculum, in the safety, health and environment conditions in the organizations, then you may find a large difference in the points. So nowadays the environment related points, that may be a global warming, that may be a acid rain, that may be a greenhouse gases, what are the sources, what are their adverse impact on the environment, then how to control these types of greenhouse gases, how to control these global warming impact or effect, and then the points which is directly related to the safe and healthy environment or the environment issues in the organization, especially when we are talking about the effluents, their characteristics, then adverse impact of these effluent, that is called as trade effluent, on the environment, and how to control these trade effluent. All these things are included in the organizations. So there are various inputs which is provided by the government. There are some inputs which is voluntarily initiated by the organizations. There are some syllabus or curriculum which is designed by the government, and some of the autonomous bodies are also designed or addition of these SHE related points in the curriculum or the syllabus from the primary level itself. So this may easily create the awareness among the people, among the students in the school level, and from the school level, if you are knowing about these safety, health and environment issues, then obviously up to the 18 years of age, you are knowing about many of the things, and you may have the issues or you may have the passion related to these safety, health and environment issues. So that may positively impact on the organizations as well. By securing the good liaison arrangements with the international organizations, so we have to work simultaneously for achieving the national objectives as well as of the international objectives. And for that purpose, we have to contact, we should be in touch with the international organizations also by providing the medical criteria. So that is one of the thing which is related to the health. So we should provide some medical provisions to the employees, to the peoples in the society, etc. Wherever necessary, which will assure insofar as practicable that no employee will suffer diminished health, functional capacity or life expectancy as a result of his work plus activities, and that in the event of such occupational diseases having been contracted is suitably compensated. So that is why we are having these rules and regulation that there should be some medical checkup before joining the organizations. Then after joining the organization, there should be again a medical checkup on the 6 months or on the yearly basis. And even after the completion of the job or the retirement, then again there should be a medical checkup, so that we can easily understand what exactly the health of that person before joining the organization, during the organization and after the retirement, so that we can easily identify is there any issues, that is especially when we are talking about the health issues in the organizations, is there any uh, diseases in the organizations, and how to control the diseases or how to satisfy the standards which is related to the health issues. So all these provisions should be made by the organizations, should be made by the organizations as well as by the government also, by providing the practical guidance and encouraging the employers and employees. So for achieving these goals and objectives, if the organizations, if the employers, if the employees are not knowing how to achieve these goals or objectives in a practical way, then for this type of execution, for this type of implementation, government should appoint some expert person for achieving these goals and objectives with the help of these employers and employees. So to ensure the workers and their representatives are consulted, trained, informed and involved in all the measures related to the safety and health at work. So if the employers and employees are knowing about these things, then that should be consulted, that should be trained through the different training programs that should be informed, then involved in some of the activities. So initially we should know the common activities, then we should know the statutory requirement, and then we have to implement, we have to satisfy all these requirements by implementing some of the measures which are related to the safety and health. Then R&D activity. So we have already talked about these R&D activities that SHE passionate persons should conduct these activities, including the social and psychological factors involved, and by developing innovative methods, techniques, including computer-aided risk assessment tools and approaches. So nowadays we are using the latest technology, we are using the computer-based control systems, can use the computer-aided risk assessment tools, because in the conventional methods there are some risk assessment tools which may directly affected on your health, and there are some risks and there are some hazards which is present while handling these types of assessment. So nowadays you can go for the computer aided risk assessment tools. So with the help of these tools, you can easily go for the R&D activities related to the SHE. By exploring ways to discover latent diseases, establishing causal connections between the diseases and work environmental conditions, updating list of occupational diseases, and conducting other research relating to the SHE problems at workplaces. So we have to discover some of the latent diseases. We have to update the list of occupational diseases, because nowadays if you are observing this coronavirus or corona family, then you can easily identify these types of viruses in the future also. So there is an updation in the diseases. So now we are facing the problems how to handle this coronavirus. Even after 8 or 9 months also, we are not easily handle these types of viruses, because they are modifying their DNA or their body structures, and that is why we are not having a perfect solution for these types of viruses. So likewise, if there are some new diseases in the environment or in the working environment, then you have to identify how these diseases are created, why these diseases are there, how to control these type of diseases, how to control or reduce the adverse impact or the risk level to the workers. By establishing research priorities as per national requirements, exploring partnership and improving the communications with various national and international research bodies. So we have to explore these social partnership, then financial partnership, then some professional partnership to improve the SHE standards. So for that purpose, we have to communicate with different partners by ensuring a coordinated research approach and an optimal allocation of resources in occupational safety and health sector for such purposes. Then occupational safety, health and skill development. So by building upon the advances which is already discussed, we have to take some initiatives by the employees, by the employers. We have to plan some training programs to achieve these SHE standards. We have to provide some information, we have to provide some advices, we have to provide some suggestions to the employees and employers for these type of occupational safety, health and skill development. By establishing some occupational health services, by accessing some standards through these different services, different sectors of economic activities, we have to integrate these health and safety into vocational, professional and labor related training programs, and as also the management training included small business practices. So we have to include these SHE activities into the vocational training programs, in the professional training programs, in the induction training programs, in the management training programs, etc. So from top to bottom, each and every person should know about these SHE goals and objectives and how to achieve these goals and objectives. By adopting this occupational safety and health training curricula in workplace and industry programs, we can go for the skill development. Then the next thing is data collections. So we have to compile these data which is related to the SHE. We have to compile this statistical data. We have to take the necessary actions. We have to conduct some national studies, surveys, or the projects from where we can easily collect these data. We can easily analyze this data, and we can easily present or communicate these data in different forms to the society by reinforcing and sharing the information and data to the stakeholder. So stakeholder may be a social stakeholder, that may be a professional partners or some social partners also. Then by extending this data coverage relevant to the work related injuries, diseases, exposure, then risk, hazards, etc. So each and every person should know about these factors which is related to the SHE. By extending these data systems to allow timely reporting and the provision of information. By developing the means for improved access to this information. So nowadays, normally the government or semi-government organizations insisted that your organization's data related to the safety, health and environment should be on the website so that the public can easily access this SHE related data, and they can aware about these hazards, they can aware about this risk, they can aware about the emergency situations, they can aware about these on-site emergency plans, off-site emergency plans, etc. Then the next point is review. So after deciding, after execution or implementation of all these things to achieve these goals, we have to take the review, we have to analyze all these activities on the basis of current status of the safety, health and environment in the organizations, and all the organizations put together can understand at the state level that state government can easily say that this is the current status of our state, and from all the states then they can review the data at the national level. So in the national level, all the state data can easily gives you the idea what exactly the changes are occurred in the organizations, in the society, which are directly related to the safety, health and environment. So that review may be on a regular basis, but that should be at least once in a 5 years for the achieving the goals and objective of this national policy. Then the last point is of this national policy is conclusion. So there is a need to develop close involvement of social partners. That is one of the major points. So we have already discussed that only government can't do all these activities to achieve these goals and objectives. That is why social partners are essential to achieve these goals and objectives. They should join to the government organizations, and simultaneously with the joint activities they can achieve the goals and objectives of this national policy. So government stands committed to review the national policy through the tripartite consultations and legislations, improve enforcement, compilation and analysis of statistics, development social programs for hazardous operations and other focus sectors, set up training mechanisms, create nationwide awareness, arrange for the mobilizations of available resources and expert sites. So these are the some of the points which is in the conclusion of this national policy. So awareness is one main point, then training mechanism is another point, then hazardous operations and the similar activities is another point, then enforcement of the laws, the rules and regulations, then review of these policies, and then resources and some expertise. So It is again a future scope of this national policy that in the coming 5 to 10 years, there is a requirement of the expertise persons in the SHE field. The national policy and program envisages total commitment and demonstration by all concerned stakeholders such as government and social partners. So our goals and objectives will be through dedicated and concerted efforts consistent with the requirements of safety, health and environment at workplace and thereby improving the quality of work and working life. So our main conclusion is that we have to work effortlessly, dedicatedly in the organizations, in the society to improve the quality of work and working life. Thank you.